library at Marianjoy Rehabilitation Hospital, and she received a grant for a wonderful website of resources for disabilities what do I say, developmental disabilities, all types of disabilities. It was a grant from the National Library of Medicine, and Nalini's going to tell you all about it. Thank you.
Do you need me to do anything? Hi, as Suzanne introduced me, my name is Melanie Mahajan. I work at Marianjoy Rehabilitation Hospital, which is located in Wheaton, Illinois. This is what it looks like, our hospital, and recently we have become part of Northwestern Medicine. Our hospital is a 120-bed facility which specializes in physical medicine and rehabilitation. And it's the only kind of freestanding rehabilitation facility in United States, in the country. We have several programs: brain injury, spinal cord injury, stroke, neuromuscular, musculoskeletal, pain management, and pediatrics. What I'm going to talk about is our pediatric program today a little bit, and then give you a little bit of history about information connections. Suzanne introduced you to that, but she didn't go into any details. It's basically a website for parents of children with developmental disabilities. It focuses on 5 conditions, and when we go to the website, you will see it. But I also wanted to share the background, how it all came to and how we got the funding. So in 2000, I've already gotten that, I'm sorry. In 2009, our pediatric program director, Dr. Keene, actually approached me. I went to see her in the office. She is an avid user of the library, and she is there almost every day. We also did some clinical librarianship with her, and I don't know how many of you are familiar with clinical librarianship. What we used to do is I would go with her to the morning rounds with other physicians, and we will write down the questions that came up while we were visiting the patients. I would come back to the library and do the searches and give her the information right away. We do have a threshold where if it's patient information, it has to be given to them within 2 hours. And we do provide minimum of 2 articles. I have been with the library for the last 30 years, and I know the physicians, they are my family, and the residents become our family. So we know what kind of information, what format of information they are looking for. I do a quick search, screen, go through that, pick up 2 or 3 articles, which we call pearl of the article, and it's given to them before they see the patient. On an average, we get about, I would say, we do about 15 or 16 searches a day, which is just the patient specific. Then we are also involved in research, and we do quite a bit of research. So the library is really busy. But when she called me, she showed me her room next to her office, which was about 12 by 12. And the whole room was full of pamphlets, articles, journals, all kinds of things. She is a very, very passionate physician, loves her children, and she wanted to give the information, what we call in medical settings, point of care. In other words, when she sees the patients, she would like to have that information available to them at in a layman's language, not the journal articles that are published in the medical field. We see her in the hallways, just lying down playing with the kids. Whenever you walk, you are afraid to even walk through that because the children are all over. But she's just an amazing person. So when I looked at her collection, she said, Nalini, I want you to organize this collection because I want to have an easy access to this collection. When I looked at the collection, I didn't know what to say because there were some journal articles which were very old. And you know, the 12 by 12 room was all full of her materials. It was a very, very extensive collection. And she used to spend her own money actually to buy these pamphlets and whatever materials she needed. So I came back to the library. So I came back to the library. I told her that I would get back to her within 2 weeks or so. I thought about it and I realized that it was impossible, almost impossible to organize that collection because we will have to do very extensive reading. And then I thought maybe it would be best if we did something online on our website. So I actually created a web page for her to see. We had some information on autism, a little bit on cerebral palsy, all the 5 conditions that we deal with, Down, ADHD, and TBI. So we met after 3 weeks. We had a meeting. The meeting was between the pediatric team, which consists of the therapist, the psychologist, the nursing, and of course the residents and physician. I showed her the page that I had created, and I was very kind of anxious because I didn't know how they would receive it, that instead of the print or the hard copy of materials, we were going to go totally online. After I finished the presentation, they just were so happy. They right away said, no, this is what we are looking for, and we want you to do that. I came back, I asked them to send their feedback to me, send also the topics of their interest, and any websites or any resources that were favorite to them. What happened though was the next almost 2 weeks, continuously we would get anywhere between 20 to 30 emails asking us to add those topics to the web page. I have a small library. It has amazing collection. We are one of the top libraries in the specialty of physical medicine and rehabilitation. Mostly our things are online. So when she told us that this is what she was looking for, we realized that we didn't have the resources to do it. I am there 32 hours, and Jane Arun, who is in the back, she is my right-hand person, and she was there officially only 10 hours. I'm already managing the website for the library, and on top of that, we had to do this. So I thought about it. We gave them a little bit of information on each topic to start with, and then I met with her 3 times, and I suggested that we seek funding. So this was my first time to ever write a grant proposal. I had never written it. We wrote a grant proposal for the National Library of Medicine, and we got the funding for $40,000. And then after that, 2 years, we wrote a second proposal and we got $25,000. So this is what is the outcome of that proposal. I'm going to go a little bit on the goals and objectives and how we achieved it. So the main goal was to develop a better understanding of the healthcare needs of the parents of children with developmental disabilities and chronic diseases. What we did was we conducted interviews, we had focus sessions, and also we had a needs assessment survey. The second goal was to develop information connections, a website for the parents of children with developmental disabilities. And we wanted to determine the final list of conditions and topics for the website, and we also had to develop a very strict criteria for adding those websites or reference sources. And of course, the ultimate goal was to deliver and access information when and where needed. And those are the two most important things in medical field: point of care and point of need. So when a physician or a clinician is looking for information to give it to their patients, they should have access to it, and they can be retrieved immediately and given to the patients and their family members. And at the point of need means when the patient or the family needs to retrieve that information, whether they are retrieving it from home, from a library, anywhere, they should be able to do it. So this is what we did. We actually interviewed 7 parents, and we had 3 focus sessions. The first focus session was within the hospital with the clinicians and with the physicians. The 2 other focus sessions were held with the family members, patients. And that's when I realized what parents go through. Even though I have worked in that hospital 30 years, and the library was right in the middle of the brain injury and pediatrics. And I used to see the kids all the time, which is very heartbreaking. But when I met the family members and they came to the focus session, they said anything, they were free to say anything. That was very an eye-opener thing for me. I realized that these parents do not have any time when their child is diagnosed with autism or cerebral palsy or Down. Emotionally, it's a very, very difficult time for them, and they don't have the time to go on the internet and go through thousands of sources. It has become a passion to me. It is my passion, and I spent actually all weekends going through the website because we don't have the resources to work. I have other work at my other responsibilities at work, so I spend my weekends, a lot of my weekends and holidays working on this website. So after these are the results. After the interviews and the focus group sessions, parents need information. Internet was #1 source. And there is too much information when they go on the internet. It is very difficult to sort, it is time consuming, and they are not certain about the reliability of the resources. After that, what we did was we actually developed a 30 questionnaire online survey. And my boss has a PhD in statistical analysis. So she helped us develop that questionnaire, and she is the one who did the data analysis. And based on that, we actually developed the website. So the SurveyMonkey was used. It was available online on the library website, also on the hospital website. We also had hard copies of the surveys available all over the hospital. And then a total of 182 surveys were received. So we were very happy because we expected maybe about 60. That's what in the proposal we had written, that at least minimum of 60 surveys we will have. But we were just thrilled to get 182 surveys. So as a result of that, I just am showing you 3 highlights. When we ask them if they use internet, and if they do use internet, what are the resources they are using to find health information? 86.5% used Google to find the information. It was actually very interesting to see that 43.7% used Medline Plus. When we did the focus sessions, there was only 1 person who knew about Medline Plus. And we think that the reason Medline Plus actually scored higher because there were school teachers, social workers, and some faculty who took the survey towards the end. So the last 50 surveys were actually open to all of them. And that's when we think that we got the Medline Plus. And then 39% used Yahoo and other search engines. 29% used library websites, and that too we think that it was because of all the educators and the social workers that used it. So we asked them what was the satisfaction rate from the internet. 38% said they were satisfied, 36.5 somewhat satisfied, and 18.3 highly satisfied. When we later on had 2 more focus sessions, we were told that they really didn't know what we meant by satisfied, because they didn't know if the information was coming from a reliable source. They just thought that they saw the information and they were happy with it. So we had no way of knowing that it was the true satisfaction for them. And the types of disability-related information, because we were going to build the website based on their feedback. They wanted condition-specific information. They wanted resources on education. They wanted resources on rehabilitation. They wanted support networks, legislation, advocacy, nutrition. They wanted information on assistive technology, and also lot on insurance, etc. So based on that, we developed the website and it went live in 2011, April. And now what I'm going to do is just go through quickly the website and show you, because I think today itself, there were 2 or 3 people who asked where are the resources available. So this is one of the resources which is available, which is very high quality, and also has been funded by the National Library of Medicine. It's like a one-stop place where you can find most of the information. We like to have a feedback from you. We are hoping that after seeing the presentation, you will go home or to your job and look at the website, and also link it to your websites for the parents. We have been very successful. We have also added a Facebook page. In the beginning, I did not have the time or the resources to do anything on the web page. But later on, we realized that social media is very, very important. I presented a paper at an international conference where we talked about medical information and social media. So we have been now using Facebook. Facebook is #1 social media that we use in the health science industry. So let me show you this. Thank you. Sorry. So this is our website. If you look at the tabs on the top, it is the home key, and we try to make it very, very simple. So that it's easy to navigate and you can get back to the pages where you started. We have a search button right here, so you can type in and go to that specific page. And then these are called breadcrumbs. We have used the breadcrumbs on every single page so that you can go back to the breadcrumb that you started with. The other thing is that each of these conditions have almost the same navigation, so it's easier. Any new website or resource opens actually in a new window. So you can close it and you are still on the website, so you're not leaving the website at any time. Because that's where people get very confused when you leave the website and start navigating through another website. So this page is autism. Before that, I want to show you the home page. This deals with all conditions. So here we usually do resources of the month. For example, this time we have Individual Education Program, IEP, and it takes you to that web page. And what we try to do is, I can go back to this of course, They just give a very brief term here, explanation, and then if there are other sources, maybe one or two we will use. For example, we selected this one because it was in very simple language for people to understand. Then I can go back, I can close this, and I can go back to this. And here we have additional resources, not just specific to autism, but all kinds of disabilities right here. Then as you go down, there is Kids Corner right here, and then there is our pediatric program, and these are the partnerships. These were very important to us. We actually talked to them, we made presentations afterwards to these organizations. And here we usually have something very important. It can be awareness month of any kind. We will do that here, and then the term of the month usually relates to the resources of the month. So if we are talking about autism, then here we have a term of the month which people can look at. And then we usually have a new book here which people can look at, and also we use actually link to connect them to Amazon right away. So this is what we have on the main page, and then at the bottom we have what are developmental disabilities. So if you go to Centers for Disease Control, it's going to take you that page where the developmental disabilities are right away, and you can find all the information about the developmental disabilities. So here are the basic, here is the research and tracking, resource center, links to other websites, etc. So a person doesn't have to go to 3 or 4 different, not go through the internet to look at various websites. Now I'm going to take you to autism. And what we have done on each page, on the left-hand navigation, we have connected it to or linked it to American Academy of Pediatrics. Then it takes you to Medline Plus, but also Medline Plus in Spanish. So if you have Spanish-speaking population, they can just go into this. I will show you quickly. And this is all in Spanish. And you can actually go back from here to English. It also shows if there are any other languages. And then we didn't want to be biased, so we have provided lots of links to you, which of course come from very good resources. And then here is the Kids Health, where if you're looking for information on kids, this is right here. What I want to show you today is this one right here for kids. And this Kids Health is a very, very reliable source. They have done an amazing thing. For each condition, they have a page for parents, for kids, and for teens. Not only that, when it's for kids, it's written at that level. So even 4 or 5-year-old can understand that. And since they don't know how to read, you can actually click on this, and it should, hopefully.
The following article is from Kids Health. Autism. When Stacy went over to her new friend Chelsea's house, she met Chelsea's 4-year-old brother, Sean. "Hi," said Stacy, smiling. Sean looked at her but didn't say anything. Then he turned back to a toy he was holding. Later, in Chelsea's room, Stacy said, "I don't think your brother likes me." "It's not your fault," said Chelsea. "It's not that he doesn't like you. Sean has autism and it's hard for him to talk sometimes. But I can show you how to play with him. How to play with him, if you want." Stacy wanted to know what autism meant. Let's find out. What does autism mean? People usually...
So I'm going to go back, but this is the kind of information it provides. And when we did the ribbon cutting ceremony at the hospital, we had invited lots of people. Actually, my grandson came. He was only 5 years old at the time, and I didn't know that he would pay so much attention to what I was saying. When we showed this particular, and we actually, because there were lots of kids there, we read the whole thing for about 10 minutes. And after that, he raised his hand and he said, "Grandma, I didn't know that my friend who sits next to me does all these things. Now I know why he does that." I mean, that was just, so precious to me that the website is able to help a child understand what the condition is. And they also do it in Spanish, so we have it in Spanish. Now, when a child is diagnosed once the diagnosis is there, naturally parents want to see what is really autism. So we start right here where it says, what is autism? This one is from the National Institute of Neurological Disorders and Stroke. And it actually, if you can't read it, it has, or if you have issues with your eyes or something, you can listen to it. The next one is what is autism spectrum disorder from National Library of Medicine. And then it is also available in Spanish. Thank you. So this is how you would start your research, and it gives you everything in details, summary, start here, and things like that. Let me go back here. So these are the overviews. Then for the developmental screening, we have several links here. Then developmental milestones. So if I go to free tools, this is from CPC. You can go to 3 months, 4 months, and it will give you what are the milestones. And then as you go down here, there are genetics, there is statistics, and then the vaccine controversy. On the top, each one of these conditions has a list of organizations, legislation, education, and on the education you will see, for example, the latest therapies are there. So if I click here, these are the therapies that we have talked about or listened to: applied behavior analysis, relationship, sensory integration. I have only a few minutes left, so I will go quickly. Then we have the Illinois resources, and then the family resources. So what we have done is we have here support groups, autism apps, blogs, respite care, and then besides that, we have all these. There is a help hotline that you can call, and then of course the other family resources, a list of them. And then we have audio and videos. And these people love because they can listen to them. So these are all the videos that we have collected from different areas. I would suggest, I don't have much time, but if you go into and dive into this, I'm sure you will find the information you're looking for. And the other thing is, if you have any suggestions for us to add anything, please contact us, because we have the bookmarks all over, and it gives you all the information and our library phone number and my phone number. So you can call us. Also, if you would like us to present in your libraries, we would be glad to come and present it in a library in details, maybe 15 minutes, half an hour, whatever you can give us. Because a lot of work goes into it. It's a labor of love for us. The doctor that I work with, Dr. Keene, she and I sometimes talk at 2 o'clock in the middle of the night as to what needs to go on the website. So it is very, very important cause to us. And one thing I want to show you is the transition. We talked about it, and I want to clarify something. Yesterday, it was mentioned that Marianjoy did not want to take up the transition part of it. What happened was, when I finished this website, I was approached by a professor in Florida University. But he wanted me to write another proposal for the information on transition, how the transition from children to adulthood. And then he wanted us to develop another website for that. By then, we were so burnt out just by this, we didn't have the time to write the proposal. But now we have started that project. We are looking for funding, but I will give you a quick review of what we are doing. So here is autism, and I have just linked this to show you it's not a live site as yet, but we are in the process of actually this site, Disability and Rehabilitation, that goes live at the end of April. And that has the transition right here, which is going to talk about, or talks about, it's not live, back to school, independent living, employment, and audios and videos. And then with the transition, you will see ideas, definition of transition services, what is transition planning, transition to adulthood, transition to, so all these different topics are going to be available. It's not fully developed, but I just want to show you what we are going to do with this. And then of course the ADA and all the rest of the sources. So just wanted to tell you that. I know I'm up, but is there any question I can answer? Yeah. Yes, the research has been published in 2 journals, medical journals, and I presented at Internet Librarian. There were 2 presentations. At Medical Library Association, there was a presentation. Last year, I presented at the International Digital Library Association. I was an invited speaker there, and they have asked me to revise the paper, and they want to publish it. I have to actually, as soon as I get back, I have to send them the revised paper. And then this year they have invited me again as an invited speaker to talk about disability and rehabilitation. So, and I have presented at many conferences. Yes?
Didn't last night you told us that you update this every day?
Yes, we do.
That's important.
Yeah, we do update it on a regular basis. At least 2-3 times a week. There are links that sometimes don't work or they have changed, but we try to update it on a regular basis. Yes?
Can you talk about any surprises or challenges you experienced while developing this study?
Yes, they were, because the timelines were so strict because of the funding. We had to give them the timeline. And it was very difficult to stay within that timeline because I had only one person. We had an amazing team because Dr. Keene was there, and then my boss, the statistician, she was also part of the team. But the best thing that happened to us was the marketing VP. And she did an amazing thing for us. Every single month, she met with us. She wanted to make sure that we have all the images that we needed. So the images that you see actually on Information Connections, they are from the children of our hospital. So those are the images. And then, the banner, the logo, everything was done with them. But that was the biggest hurdle, was meeting the deadlines and the time, and the budget. So we were very fortunate that Marianjoy actually matched the last funding of $25,000. So that we were very fortunate because of that. Yes?
Do you have bookmarks that you can distribute if I would ask you for a pack of 50 or 100 or something like that?
Yes, definitely. Just let us know and we will mail it out to you. Actually, I forgot, but Jane has a poster which the marketing division made it for us. There, you can see the... So if anyone would like to display that in the library, we would love to send it out to you. Any other question? Well, thank you so much for giving... I just want to